Hey guys, I'm Dr. Jeremy.
I'm Dr. Jessie.
We're from Sprouting Health Chiropractic Kinesiology, and we hear, I pinched a nerve a lot, right?
Yes, all the
Did you
time,
do that?
yeah.
Someone might be holding their neck or holding their back, but they might be touching their foot or their arm. And this is quite common because pinched nerves can create a lot of different types of feelings. But one of the common ones that we hear is sciatic pain. And sciatic pain is the nerve where it runs down the back of the leg into the foot. Sometimes you don't even feel it down the back of the leg. True sciatica actually is from the knee down to the foot, which is really, really interesting. So there's lots of type of pinched nerves. Probably today we might talk about some of the symptoms that you'll feel of a pinched nerve, and then also what we might be able to do about it as well.
Absolutely, and a lot of the time people come in and they might even say, oh, I'm getting this weird burning sensation or this heat even, or pins and needles, and I'm feeling it in my wrist, so it must be wrist pain. And that can be the case, but a lot of the times that's when we're getting that radicular pain or that pinched nerve sensation where we feel like it's happening lower down in our limb, whether that be our arm or our leg, and it's actually stemming from, in our upper limb, the case of our neck, and in our lower limb, it'd be the case of our lower back. And that's when we get that kind of either pins and needles or numbness or that burning sensation. And a lot of the time, it can be kind of dealt with an adjustment or even some soft tissue therapy, kinesiology, things like that to help free up that pinched nerve sensation that you're getting.
Yeah, absolutely. So what Dr. Jessie's saying there makes a whole lot of sense. And if you think about it, the nerve supplies the feeling, but it also supplies the movement. So there can be feeling issues like the pins and needles burning that we've spoken about, or there can be a loss of actually control. And that's what, when you guys come in here, that's what we do. We test nerve reflexes and we test a whole lot of muscle control and stabilisation in your body, and we can work out where the brain's controlling or has a lack of control of that body part. So for example, we might see someone who keeps twisting their ankle or has a sore wrist, and we find that there's a muscle that's dropped out that controls the wrist. And there's some certain things we might do with the wrist, arm and neck to help bring that control back to the hand, which can massively help a wrist issue, for example. So if you've got some weird issues that you've been putting up with, or obvious ones like a pinched nerve pain driving down an arm or a leg, don't put up with those guys, and especially the ones that you don't know where they're coming from, like a recurrent sore knee or an ankle or a hip or something like that. Because we can run lots and lots of tests on those. So if you know anyone that has any of those weird pains or symptoms that aren't going away or they're annoying them, don't put up with them. Send them in, guys. We'll run heaps of tests.
Absolutely.
And we'd love to see if we can help you. And as we always say, if we can't help you, we're going to tell you straight away because we don't like wasting people's time and money. So Sprouting Health Chiropractic Kinesiology, send people in if they've got some weird issues because there's too much stress out there without having to put up with these other little things. And health's probably your most important asset, guys. So it's something you want to be looking after.
Absolutely.
Enjoy your long weekend.
See you guys.